Overeating, not eating, binge eating. Some of the signs a person may demonstrate if they have an eating disorder. We spoke with Dr. Jennifer Johnson of Hoag Memorial Hospital Presbyterian in Newport Beach to find out what to look for if you suspect someone has an eating disorder.
The most common eating disorders are probably the ones that we don't diagnose, such as overeating, disordered eating, binge eating. But when we talk about eating disorders in the medical sense, we're usually talking about anorexia and bulimia. For anorexia, there are two peaks of onset. One is about age 12 or 13, and the second peak is about age 17 or 18. But it's within that time frame that most patients with anorexia develop their disease. That's changing. We're seeing eating disorders in kids as young as 9, 8, 10. Bulimia tends to develop when women are a little bit older, so less so in the 12 and 13 age group. But it's very common for someone at one point to have anorexia and then to seemingly recover from that, and then 6 months later to start binging and purging with bulimia. Everyone who has an eating disorder is preoccupied with food. If you have anorexia and you are not eating, you have a distorted sense of your body and you feel very large, even though by your and my standards, you're looking like you're starving to death. So that sense of distortion is something that is part of the diagnosis of anorexia, but it's not something we see on the outside. What we see instead are people who start eating alone, who skip dinner, who may sit down with the family and feed tidbits of their food to the family dog, or spend 45 minutes cutting up one little piece of meat into exactly 30 pieces and eating 3 of those pieces. Those are some of the behavioral signs of anorexia. Bulimia is different because people who have bulimia tend to overeat. They eat a large amount of food in a short period of time, and that's often done in secret, and then go and throw it up. People with anorexia nervosa, about 25% of them get well and stay well. About 50% of them, as a long-term consequence, struggle through the rest of their life with their eating disorder. And about 25% of people with anorexia just really don't get better at all, and they live a very miserable life. For someone who has anorexia as a teenager and recovers, the long-term prognosis is great, assuming that they haven't had bone mineral loss. Women with anorexia who have stopped having periods have stopped building bone mass for that period of time. And we are seeing women in their early 20s who have osteopenia and frank osteoporosis because of the length of time that they have gone without having periods, and that's something that can't be cured.
We asked Dr. Johnson what options are there for patients with eating disorders.
There's actually a full range of options. It ranges from outpatient treatment to intense hospitalization programs. And the type of treatment that we recommend depends on how long-standing the eating disorder is, how the person is able to function in the community, and the kind of social support they have for their recovery.